How you doing today? My name is Thuan. I'm here to do another demonstrational video on directional based stretching. Today we have Kyle. He's going to be working with us today. Today we're going to be focusing on core, hips, quads, and we'll get into a little bit of the midsection with it as well. A little bit of the IT band just because those always lock down. So Kyle, if you wouldn't mind having a seat for me. His internal rotation, approximately 5 to 10 degrees, or external rotation, I apologize. Internal rotation is about the same, maybe a little bit more. I'd say it's about 15 degrees before he compensates at the hip. On the other side, external rotation. This one's a little bit better. It was about 15 to 20 on this side, and about 10 to 15 on internal rotation. If you can lay out for me. Those legs down. The straight leg raise is about there. On the other side, up. And he stops about there. So we can get about, I'd say about 40 to 45 degrees bilaterally. So one of the things that we always want to do is with directional based stretching is you always got to start at the core. You always got to work at the triangle and work your way down. So it doesn't matter if you're working up through the extremity or working down through the legs, you always start at the stomach and you always work from there first because all the attachment points are proximal. So what you want to do is you want to find the ASIS. This one's a little bit tender because of all the hip flexors. So you have the psoas that goes over the top, the hip flexors, the quads, the IT band, all the groin muscles, and everything that creases right along the groin itself. So you have the whole pelvic floor that locks up. And because we sit a lot, we actually have to free all this up too because we're gonna naturally pucker. And so, I'm gonna scoot these down just a little bit. So what you wanna do is you wanna hook the skin and pull upward on it and grab the ASIS. You can actually see the skin puckering from it. The skin can get stuck to the ASIS in the hip joint itself and the bone itself, and there's actually a divot within Kyle's right there because he creases. And so that's what we need to free up his leg. We do a rotation with the leg while we're anchoring at the skin. It helps move the hip joint itself. You change the angle as it moves because once this part frees up, you'll feel it release, and so you change your hand pivot. So now it's more towards the medial side, and then you rotate the skin outward and down towards the iliac crest. And there's that rotation. And then you want to do it again. Anchor and push through. So you're trying to give the normal movement back into the skin itself and back into the joint. You want to anchor and push through that iliac crest. Rib cage and obliques always lock up with it. So you have to come in through the side. You can see the immobility right at the ribs. None of the skin is moving properly. It's all stuck going backwards. It's okay going forwards. The whole thing can go forwards, but going backwards, there's limitations. So that's what you need to open up, and that's along that rib cage. And it puckers right at that xiphoid process, and that's the top of that triangle. So when you open up, you have to open across that rib cage. Pull down and out. Again, you're stretching the skin, and that helps free up the lats on the back side. Good breath. Ready? One more time. Down through. Good. And you can see the difference in the skin. Right along that rib cage, everything's now moving properly. you at least get the back. The front's still moving. It's just a little bit limited. That's a lot from the lats, and it's a lot from the obliques as well as the QL. And that you have to wrap around the backside. So if you go forward, if you go backwards with it, you have to go forwards with it. You have to do the counter positioning of it because the skin wants to be mobile in all directions. Because everything we do is always in a frontal plane. We have to do rotations with our stretches to stretch everything else out. Otherwise, we're going to get locked up in that frontal plane. Do that earlier press again, we move that leg. And try and get that low back. This is good for anyone that has low back pain, sciatic nerve pain, sorry about that, sciatic nerve pain, femoral nerve pain, hip flexor pain, even people with have bowel and bladder issues. Because we sit so much and we pucker along that baseline, the intestinal organs, and they always get bound down, so the large intestine can get blockage in it. And so whenever you actually get that release, you can actually increase bowel movements as well. So anyone that has true blockage and that can't really go to the bathroom, if you do an abdominal massage for them, it actually changes the infrastructure of the intestinal organs and it allows the blockages to be released. So you get a better bowel movement. And most people have it within the same day, if not the day after. And so this is especially important for anyone that's wheelchair bound or anyone that sits a lot because they have decreased ability to have their bowel movements and it changes how they can function. Once you're happy with the abs, what you want to do is you want to bring the leg up, bend the knee. You want to go through that hip again. Because now you have the leg down, and now you want to work with the leg up as well. Try to bring it there, hold it for me. Good. Because it's not just the first position that you hold it in, you have to go through the entire range of motion of the hip. And that's the only way you can truly free up the low back. And free up the hips. Good. Bring it all the way up. Stabilize. And work here. All the way up. And that gives that low back stretch that you're looking for. Good. And you come up and over to get that twist, because again, it's always with a rotation. I always anchor and put it on my chest. You can put it on your stomach. You can even use your other elbow if you want. Whatever is most comfortable for you. But I like those hands. Go with the range of motion. And give them a little nudge to get that skin moving. Sorry, nice deep breath. And there it all goes. Once you're happy with that, that opens up the hip, that opens up that quad, that opens up that whole section. Kyle, sit on up for me. Alright. We're going to go through our tests again. We're going to go with internal rotation, and you can see the difference. We're going to go external rotation, and you can see the difference. These are about 20 to 25 degrees of external rotation. Internal rotation is at least 30. Can you lay down on your back for me? Straight leg raise. Anchoring at the hip. And he just comes right on up. He's at a good 65, 70 degrees. So, if you work through the abdominals, and you work through the hip flexors, you can free up that side. This is good for anyone, like I said, that has numbness and tingling down the leg, shooting pains, hip pain, IT band syndrome, It actually works with a lot of bowel and bladder issues as well, because you're freeing up that whole side, you're loosening up the hip, and you're able to get a better flex with it. Anyone with low back pain, I always go through the low abs first, just because everything puckers, and when you pucker, you're going to arch your back. So if you free it up and lift from the bottom stomach, it changes your hip position, and it allows you to be in a better position, so your lumbar isn't as bad, and it's not as much pressure on that low back. Give it a try. Let me know what you guys think. Check me out on Instagram and Facebook, thuandvudpt@gmail.com. Thanks, and I hope to see you next time.